Welcome back, guys. Now let's continue with the second type of ascending tract, which is called as a dorsal column pathways. See, these dorsal column pathways, they are considered to be advanced. Okay, they are considered to be advanced. They were developed recently. Okay, in the evolution, they were developed recently. And what they are carrying? They are carrying some advanced sensations. Okay, what are these advanced sensations? They are not going to carry just normal touch, pain, temperature, pressure. They are going to carry a bit advanced sensations. What are they? They are carrying sensations like fine touch. Fine touch. So it's not just the crude touch, a slightest form of touch. That's like a fine touch. See, we can even feel our sensations. See, our sensations are so well developed that we can feel even the slightest form of touch, like even with the feather, that feathery touch, you can feel it. So that is called as a fine touch. Next, a vibratory sense. So this vibratory sense also considered to be advanced. Next, 2-point discrimination. So what exactly is this 2-point discrimination means? See, 2-point discrimination means our sensations are so well developed, we can differentiate between the point number 1 and point number 2. For example, see, most of the students will confuse here. Try to understand. Imagine this is my finger. Okay, this is the tip of my finger. See, there are lots and lots of receptors. My receptor density is so much. Okay, there are lots and lots of receptors on my skin that I can differentiate the point number 1 from point number 2. Okay, let's say I am touching here. Okay, with a pin. With a pin I am touching here on one point. Within a very slightest distance, within a very few millimeter distance, I am touching here. Okay, point number 2. So I will still recognize, I can still feel that you are touching on my skin. I am not looking. You are touching on my skin on 2 different points. I don't recognize it as a one single point. Okay, even though you are touching within a very close proximity area, I can still say, sir, you are touching on my index finger, the tip of my index finger on 2 different areas, because there are lots and lots of receptors. My receptor density is so high. My sensations are so well developed. I can discriminate between the point number 1 and point number 2, even though they are in very close proximity. That's a 2-point discriminatory sense. Okay, I can discriminate between point number 1 and point number 2. Let me explain the same thing in a different way. Let's say on a table. Okay, here there is a table. Okay, here there are 2 bumps, 2 elevations are present. Okay, point number 1 and point number 2. Okay, 2 small elevations are there. Okay, see, imagine I am closing my eyes and I am touching there. Okay, I am just touching the table. So even though the distance between these 2 points is very less, okay, they are in very close proximity, I can feel it. Okay, here is point number 1 and here is point number 2. Okay, even though they are very closely attached points, I can say, okay, here is point number 1, here is point number 2. So that is 2-point discriminatory sense. Now you understand for whom it is very helpful. For the blind people, they can read Braille script. Okay, so we are having this 2-point discriminatory sense so that we can understand what is written over there. We can identify, okay, point number 1, point number 2. Okay, so there is something called as a Braille script, right? So you can understand what is written over there. Okay, blind people. So yes, this 2-point discriminatory sense is also considered to be advanced. So fine touch, vibratory sense, 2-point discrimination. Next, conscious proprioception. Conscious proprioception. Okay, so what exactly is this conscious proprioception means? So conscious proprioception means when you think consciously, you know where your body parts are. I may not be knowing where your body parts are, but I know where my body parts are. Even without looking, I can say, here is my thumb, here is my index finger, here is my middle finger, here is my shoulder, here is my elbow. So how is it possible? Even without looking, I know where my joints are, where my body parts are. Here is my little finger, I know. So how do I know? Because some sensation is going from here to my brain. So that is called as a conscious proprioceptive sense or joint positioning sense. I know where my joints are, whether they are flexed, whether they are extended, and what is their position in this 3-dimensional space. That is called as a conscious proprioception. Okay, when you think consciously, you know where your knee is, where your foot is, where your heel is, you know. Okay, that is called as a conscious proprioception, also advanced sensation. Next, stereognosis. So what exactly is stereognosis? Stereognosis means it's the ability to identify the object with tactile sensation. Ability to identify objects with hands without looking, even without looking. See, even with my closed eyes, I can just feel it and say, okay, it's looking like a pencil, it is looking like a box, it is looking like a mobile phone, it's looking like a tab. So even without looking, just with the tactile sensations of the hand, okay, just with the tactile sensation, I can know what is this object. So that ability is called as a stereognosis. Okay, stereognosis is what? It's the ability to identify the objects only with hands, guys, not with the foot. Okay, some people will say I can identify the objects with foot also. That's not stereognosis. Okay, then what about the conscious proprioception? Conscious proprioception, I have told you, it's a joint positioning sense. Joint positioning sense means ability to identify your body parts in the three-dimensional space. Okay, so these are the advanced sensations. Okay, these five are the advanced sensations recently developed in the evolution. So how these sensations are going to the brain? Okay, how these sensations are going? Are they going through the anterolateral spinothalamic tracts? No. See, through the anterolateral pathways. Okay, that's the anterior spinothalamic tract and the lateral spinothalamic tract. Through the AST and LST. What type of sensations are going? It's like touch, pain, temperature, pressure. Okay, these sensations are going. But what about the advanced sensations? So the advanced sensations are going through the pathway called as the dorsal column pathway. They are going through the dorsal column pathway. So how is it going? Let me explain you. We all know here is the brain, okay, and here is the brain stem, and down to it here is the spinal cord. Now I am taking the cross section at two different levels. The cross section at the upper half of the let's say upper part of the spinal cord, and the cross section at the lower part of the spinal cord. Okay. Now here is the right side of the body, and here is the left side of the body. Let's say, students, I am asking you. You tell me, where do you think these advanced sensations are present? This fine touch, vibration, proprioception, 2-point discrimination, these advanced sensations. Do you think these advanced sensations are present on the upper part of the body or lower part of the body? The answer is both. You can feel the vibration in the lower part of the body. You can feel the fine touch in the lower part of the body. You can feel the conscious proprioception in the lower part of the body. Okay. So, yes, these sensations are present both in upper part of the body as well as lower part. But stereognosis is only from the upper part of the body. That is the ability to identify the objects. Now, sir, these advanced sensations, first let's start from the lower parts. The advanced sensations from the lower parts of the body is going through this first order neuron. Here is the first order neuron. This red color neuron is the first order neuron. It is carrying the advanced sensation from the lower parts. So where these advanced sensations are going? See, the advanced sensations are entering into the spinal cord. Yes, sir. Are they going into the dorsal column? No, these advanced sensations, they are not entering into the dorsal horn. They are not entering into the dorsal horn. They are directly entering where? Into the dorsal column. So yes, advanced sensations do not enter into the dorsal. They do not enter into the dorsal horn. They directly enter into where? Dorsal column. And from here, okay, from here, where is it going? Sir, they are going up, ascending up, and they are going to the medulla. Okay, they are going to the medulla. So now, can I call them as ascending tracts? Yes, the sensations are ascending up. Can I call it as a can I call it as a spinothalamic tracts? No, because the information is not going to the thalamus here. The information is going up to the medulla. The information reached only to the medulla. Okay, information came to the medulla. So yes, these are not spinothalamic because they are not going to the thalamus. So what is this called as? So this ascending tract, okay, which I am showing here in the red color. So this is called as fasciculus gracilis. The name of this ascending tract is called as fasciculus gracilis. So now tell me, what exactly is fasciculus gracilis means? From today, fasciculus gracilis is an ascending tract. It is carrying the advanced sensations from the lower part of the body. Next question. So these advanced sensations, are they crossing to opposite side in the spinal cord? No, they are not crossing to the opposite side. Advanced sensations do not cross to opposite side in spinal cord. Okay, in the spinal cord they are not crossing. So finally tell me, where this advanced sensation came? So this advanced sensation finally came to the medulla and it is terminated. This first order neuron, it is terminated in a nucleus called as nucleus gracilis. Fasciculus gracilis terminated in nucleus gracilis. Then what about the advanced sensations from the upper regions of the body? Advanced sensations from the upper parts of the body. Sir, these advanced sensations from the upper part of the body is taken by this first order neuron. Okay, this first order neuron, orange color neuron. Okay, so yes, advanced sensations are entering into the spinal cord. Which part of the spinal cord? Into the dorsal column again. Okay, so here this is also ascending tract, guys. This orange color is also ascending tract. But what is the name of it? The name of this ascending tract is called as, this orange color guy, this is called as a fasciculus cuneatus. Okay, fasciculus cuneatus. Now tell me, what is the difference between fasciculus gracilis and fasciculus cuneatus? The difference between the fasciculus gracilis and fasciculus cuneatus is Fasciculus gracilis carries the advanced sensation from the lower part of the body. Fasciculus cuneatus carries the advanced sensation from the upper part of the body. What is something common between them? The something common between them, both are first order neurons. Okay, both are carrying the advanced sensation from the same side of the body but not opposite side of the body. Okay, same side of the body. If I ask you, if I take the cross section of the spinal cord at the lower parts, okay, if I take the cross section at the lower part of the spinal cord, I will see which tract? I can only see the fasciculus gracilis. But if I take the cross section at the upper part of the spinal cord, at the cervical region, let's say, I can see both the fasciculus gracilis as well as fasciculus cuneatus. So fasciculus cuneatus, is it present in the lower part? No, definitely not. Definitely not. Next step. Tell me, who is traveling more medially? Who is more medial? Medial means towards the center. Sir, fasciculus gracilis is more medial, fasciculus cuneatus is more lateral. Okay, more lateral. Why you should know this? Later they will ask you if there is damage to the medial part in the dorsal column. If there is damage to the medial part in the dorsal column, fasciculus gracilis is affected. If there is damage to the lateral part in the dorsal column, fasciculus cuneatus is affected. Okay, so finally tell me, where this fasciculus cuneatus is coming? Sir, fasciculus cuneatus ultimately came to nucleus cuneatus in the lower medulla. Nucleus cuneatus in the lower medulla terminated. Fasciculus gracilis terminated in nucleus gracilis. Fasciculus cuneatus terminated in nucleus cuneatus. First order neuron story completed. Now, let's talk about the second order neurons. We all know the second order neurons are going to start from here, from the nucleus gracilis. Second order neuron started, and what is the property of the second order neuron? Second order neurons cross to the opposite side. Yes, the second order neuron is crossing to opposite side, and this one also. Okay, sir, second order neuron is crossing to opposite side. Second order neurons crosses. Now, where do you think the second order neurons are going? Say the second order neurons are going up. This red color neuron, it is also going up. Okay, so now tell me where they are going. We all know the sensations will go to the thalamus. So these second order neurons, from here they are going to where? They are going to thalamus. So here is the thalamus. The information came to thalamus. Which nucleus of the thalamus? Same ventropostolateral nucleus of the thalamus. The information came, even these advanced sensations are also coming to the ventropostolateral nucleus of the thalamus. Now question is, sir, are we going to call them as fasciculus gracilis and fasciculus cuneatus now? No, we are not going to call them as fasciculus gracilis and cuneatus, because fasciculus gracilis and fasciculus cuneatus are terminated in the lower medulla. They are gone. Okay. Now these are the second order neurons. The second order neurons which are crossing to the opposite side and going up. Now what is the name of this tract called as? Okay, what is the name of this tract? Okay, which is carrying the advanced sensations. So this tract here I am naming it as the medial lemniscus. So you have heard about this, right? Medial lemniscus. So entire pathway I am going to call it as dorsal column, medial lemniscal pathway. Okay, dorsal column, medial lemniscus pathway, which is carrying the advanced sensations. Now you tell me, the medial lemniscus, is it going to carry the advanced sensations or general sensations? Yes, advanced sensations, sir. They are carrying the advanced sensation. From the same side of the body or from the opposite side of the body? From the opposite side of the body. From the opposite side of the body. This is the left-sided medial lemniscus, right? Okay, whatever you are seeing here, this is the left-sided medial lemniscus. The left medial lemniscus is carrying the sensation from, advanced sensation from the right side of the body. So from this, we can say, advanced sensations, are they crossing to opposite side? Yes. Advanced sensations are crossing to opposite side, not in the spinal cord but in the medulla. You tell me, damage to medial lemniscus, left medial lemniscus, advanced sensations are lost on the right side of the body. Damage to fasciculus gracilis or fasciculus cuneatus, loss of advanced sensations on the same side of the body, Okay, now again repeating, the right sided, okay, right nucleus gracilis and right sided fasciculus gracilis or fasciculus cuneatus damage, right side. Sensations, advanced sensations are lost on the same right side. But if the left medial lemniscus is damaged, the sensations are going to be lost on the right side, on the opposite side, right? Okay. So this is what I want you to know. From here, tell me, from the thalamus, where do you think the sensations are going to go? From the thalamus, the sensations will go to the cortex. Which cortex? Somatosensory cortex. Third order neurons. Okay. The third order neurons are going to carry these advanced sensations. Okay, going to carry the advanced sensations, the somatosensory cortex. Okay, so with this, what we have done, we have completed with the dorsal column pathways also. So the dorsal column pathways, which include fasciculus gracilis, see the fasciculus gracilis and fasciculus cuneatus, these are the dorsal column pathways because they are traveling the dorsal column of the spinal cord. They are carrying which sensations? They are carrying advanced sensations from the same side of the body. What are the examples of the advanced sensations? Fine touch, vibration, proprioception, 2-point discrimination and stereognosis. Now, how the questions are going to show up in your exam? The question is, stereognosis is carried by which dorsal column pathway? Tell me. Sir, stereognosis, it is an advanced sensation. That too with the hands. Hands means what? It's the upper part of the body. It's with the upper part of the body. So, now tell me which dorsal column tract carries this stereognosis? The answer will be stereognosis carried by, think before I write, carried by fasciculus cuneatus. Okay, this was the question already asked in the exam. Okay, stereognosis is from the upper part of the body. So, who is carrying the advanced sensation from the upper part of the body? Fasciculus cuneatus. Simple. Next step. One more question. See, there is an infection and there is a vitamin deficiency where the dorsal column pathways will be affected. Dorsal column pathways are affected in. Okay, let me write here. Dorsal column pathways. Affected in which vitamin deficiency? Number 1, affected in vitamin B12 deficiency. So, if a person is having vitamin B12 deficiency, especially the dorsal column pathways will be affected. There is going to be demyelination of the dorsal column pathways. The person is going to lose the advanced sensation, especially the vibratory sense and the proprioceptive sensation is going to be lost. Okay, so that condition is called as subacute combined degeneration of the spinal cord. Okay, subacute combined degeneration of what? Spinal cord. That's due to vitamin B12 deficiency. And the dorsal column pathways are also affected in infection. That is tertiary syphilis. So, in tertiary syphilis, okay, tertiary syphilis, this infection, the infection because of the Treponema pallidum, the dorsal column pathways are affected, okay, leading to a condition called as tabes dorsalis. Okay, tabes dorsalis. Okay, so these are very important MCQs which I want you to know. Next step, how clinical questions are going to show up in your exam. Okay, let me write here. Damage, let's say damage to medial lemniscus. What will happen? Okay, damage to medial lemniscus, what will happen? Next one, damage to fasciculus gracilis or fasciculus cuneatus. What will happen? You tell me. Damage to medial lemniscus, sir. So, if the medial lemniscus is damaged, there is loss of advanced sensation. Okay, advanced sensation loss from opposite side, from the opposite side. Okay, from the opposite side. But if the fasciculus gracilis or fasciculus cuneatus is damaged, for example, on right side of fasciculus gracilis is damaged, there is going to be loss of advanced sensation on the right side of the body. So, loss of advanced sensation, from same side. Okay, this is how the question is going to be asked in your exams. Okay, so I am just erasing this because I have already explained you the vitamin B12 deficiency. Vitamin B12 deficiency is going to cause a damage to the dorsal column pathways. Tertiary syphilis is going to cause a damage to the dorsal column pathways. That condition is called as a tabes dorsalis. Medial lemniscus damage going to cause the loss of advanced sensation from the opposite side of the body. Fasciculus gracilis or fasciculus cuneatus damages means there is going to be loss of advanced sensations from the same side of the body, on the same side of the body. Okay, chalo. Next step, a few more clinical questions I am going to explain you. Now, look, before going, see, these are the single liners. Anterolateral pathways, have I discussed with you anterolateral pathways which are nothing but the spinothalamic tracts, anterolateral spinothalamic tracts. Anterolateral pathways, they cross at the level of spinal cord. Yes or no? Yes, they are crossing at the level of spinal cord. And the anterolateral pathways carries which sensations? Carries general sensations. Okay, they carry general sensations. Then what about the dorsal column pathways, guys? So, the dorsal column pathways, they carry advanced sensations. Okay, they are carrying the advanced sensations, but they cross. Okay, they are also crossing. These advanced sensations are also cross at lower medulla. Okay, they are crossing at the lower medulla, guys. Okay, fine. Next, sir, how the question was asked recently in the exam. See, the question was something like this. A patient is having a stab injury or bullet injury. Let's say the patient had a bullet injury. During this bullet injury, the lateralmost column or the lateralmost part of the dorsal column is affected on the right side. The patient is going to lose which sensations on which side of the body. So again, I am writing here. There is a patient who had damage to lateralmost column or lateralmost part of dorsal column on right side. Which sensations are lost? On which side of the body? So how to understand this? Let's draw a cross section of the spinal cord here. Here is a cross section of the spinal cord, and you know here is the dorsal column. These are the dorsal horns and ventral horns. Here is the right side of the body, here is the left side of the body, let's say. Now you have to tell me what is this tract that I am showing here in the center. What is this tract, guys? This is the fasciculus gracilis. Okay, let me write. Here is the fasciculus gracilis. Here is the fasciculus gracilis. On the lateral side, here you can see this is the fasciculus cuneatus. Fasciculus cuneatus. Okay, fasciculus cuneatus. Now, in the question, they are clearly saying there is a damage on the lateralmost part of the dorsal column on the right side. So, on the right side, the lateralmost part is getting affected. So, lateralmost part means this area. Okay, in the dorsal column, within the dorsal column, the lateralmost part is getting affected on the right side. So, now tell me, so this area of the spinal cord is getting damaged. Okay, this area gone. So, which tract is affected? It's the fasciculus cuneatus affected. So, now the patient is going to lose loss of advanced sensations like vibration, proprioception. Loss of advanced sensations from right upper parts of the body. Right upper parts. Or you can say right upper limb. Okay, right upper parts. So, this is how the question was recently asked. The patient is going to lose the vibration proprioceptive sensation from the right sided upper limb or the upper part of the body. Okay. So, with this, what we have completed? We have completed how the clinical questions are going to be asked. Now, let's see some more important points about the thalamus. Have we already discussed thalamus? Thalamus is going to receive all the sensation. Doesn't matter general sensations or advanced sensation. Receive all sensations from body. That's it. Including general sensations, advanced sensation, special sensation, every sensation has to first go to the thalamus. Okay, except one sensation. Except one, that is olfaction. Except smell, all other sensations. Except smell, all other sensations first has to go to the thalamus. Okay. Now, first thalamus receives the sensation. First, what the thalamus is doing? Thalamus is receiving the sensation. Later, thalamus will say, okay, touch, you go here, pain, you go here, temperature, you go here, okay, fine touch here, vibration here, something like that. Okay, it's going to disperse these sensations to different parts. Okay, vision, you go here to the occipital lobe, hearing, you go to the temporal lobe, something like that. So, this thalamus, what it is doing, it is relaying the sensations. Okay, it is relaying the sensations to the cortex. Relay means sending. So, thalamus is considered as a relay station because first it receives all the sensation, later it will relay to the different parts of the cortex. So, yes, thalamus is considered as a relay station because it's a relaying sensation to different parts. Okay. Next, thalamus is going to give rise to which order neurons? Thalamus is going to give rise to third order neurons. Okay, thalamus gives rise to third order neurons. Next, which nucleus receives the sensations, guys? Who is receiving the sensations? You all know all the sensations has to go to the VPL nucleus, ventroposterolateral nucleus. Okay, all the general sensations as well as the advanced sensations are going to VPL nucleus. Special sensations will go to the different nucleus. For example, like vision will go to the lateral geniculate nucleus. Audition will go to the medial geniculate nucleus. Okay, vision will go to the lateral geniculate nucleus. Audition will go to the medial geniculate nucleus. Okay, that's different. Special sensations are going to different nucleus. Like taste is going to a different nucleus, like a ventroposteromedial nucleus. But so far, I am talking about general sensations and advanced sensations. General sensations are going where general sensations and advanced sensations both are going to the same nucleus called as a VPL, ventroposterolateral nucleus. Okay, so done. So thalamus topic also completed. All sensations has to first go to the thalamus except one, that is olfactions. So with this, both the type of ascending tracts completed. One is what? One is the spinothalamic pathways. The spinothalamic pathways which includes anterior spinothalamic and lateral spinothalamic. Okay, the anterior spinothalamic is carrying crude touch and pressure, lateral spinothalamic is carrying pain and temperature. Then what about the dorsal column pathways? Dorsal column pathways also include two. One is fasciculus gracilis and cuneatus. Gracilis from the lower part of the body, cuneatus from the upper part of the body. The difference between the spinothalamic and dorsal column pathways is spinothalamic carries the general sensations and dorsal column pathways carries the advanced sensations. Okay, with this the ascending tract topic is completed. In the next we'll be discussing about more clinical conditions like what happens in the Brown-Sequard syndrome and Syringomyelia. Now let's continue with the more clinical conditions, that's the Brown-Sequard syndrome and Syringomyelia. What exactly is happening in the Brown-Sequard syndrome? Here in Brown-Sequard syndrome, there is going to be hemisection of the spinal cord. Half of the spinal cord got damaged, either right half or left half. Okay, either right half or left half got damaged. So what kind of clinical features are going to be there? Let me tell you. Guys, look here. Here I am writing right side and left side. You all know here this is the fasciculus gracilis, which is more medial, and fasciculus cuneatus, which is more lateral. And what exactly are these two tracts? Here is the lateral spinothalamic tract and here it's the anterior spinothalamic tract, which are carrying the general sensations. Now you tell me, when half of the spinal cord is damaged because of something, because of some stab injury or because of some bullet injury, something happened. So at one particular segment, half of the spinal cord got cut, gone. So now you tell me, see, half spinal cord gone. So is it the dorsal column tracts which are affected, or is it the anterolateral tracts are also affected? Tell me, is it the dorsal column tracts only getting affected or anterolateral tracts are also affected? You tell me. Both are affected, no. So there is damage to the dorsal column tracts as well as the anterolateral tracts on the left side. Now what will happen? Sir, due to the damage to the dorsal column tract, which sensations are going to be affected? So there is going to be, sir, dorsal column tracts are affected. So there is going to be loss of advanced sensations. There is going to be loss of advanced sensations. And due to the damage to the lateral spinothalamic tract and anterior spinothalamic tract, there is going to be loss of general sensations. Okay, there is going to be loss of general sensations. But difference is, these advanced sensations are going to be lost on the same side of the lesion, that's the left side. So this person is going to have the loss of advanced sensations on the left side, but loss of general sensations on the right side, because you know, general sensations from the right side of the body is going to cross to the opposite side. Okay, so general sensation from the right side of the body will cross to the right opposite side. So now you tell me, due to the damage to the dorsal column tract, the patient is going to lose the advanced sensations on the same side, but due to the damage to the anterolateral pathways, the general sensations are lost on the opposite side. So tell me, what happens in the Brown-Sequard syndrome? Sir, yeah, Brown-Sequard syndrome, which is a hemisection of the spinal cord, means half spinal cord cut. So there is ipsilateral loss of, means same side loss of, or you can say in our particular case, the left side. Okay, the lesion is on the left side, no. So there is left side loss of, ipsilateral means same side, ipsilateral loss of advanced sensations and contralateral loss of, means opposite side loss of general sensations. Okay, so that's what is Brown-Sequard syndrome. Very simple. Whenever there is half of the spinal cord is damaged, both the dorsal column pathway is affected as well as the anterolateral pathway is affected. Both are affected, but the sensations are lost on the different side of the body, because dorsal column pathways carries the advanced sensation from the same side of the body, but this anterolateral pathways carries the general sensations from the opposite side of the body. So okay, so with this what we have completed Brown-Sequard syndrome. In Brown-Sequard syndrome also some motor losses are also seen. Okay, because these horns are also getting affected, right? Some more losses will be seen, but that I am not discussing now. Okay, because we haven't discussed about the motor physiology so far, descending tract so far. I am not going to that area. So now tell me, only sensory losses. I am talking about only sensory losses. Same side loss of advanced sensations, opposite side loss of primitive sensations or general sensations. Okay, now let's discuss about Syringomyelia. What does it mean by the word syrinx? Syrinx means cavity. The word syrinx literally means cavity. Okay, cavity development, where the cavity is developed within the milia. Milia meaning word spinal cord. Okay, the word milia means spinal cord. Spinal cord. So there is a degenerative cavity, a cavity is forming within the spinal cord. You can see in this MRI, okay, here is a pons, you can very clearly say, sir, here is a pons, here is a medulla, and down here is the spinal cord, back here is the cerebellum. Now within the spinal cord, are you able to appreciate there is a cavity, this white color area? Okay, this white color area, here is a cavity. So that's the Syringomyelia. Okay, let me write here. Here it is Syringomyelia. This cavity is the Syringomyelia. Now what happens? Let me show you. Sir, in this cross section of the spinal cord, in this cross section I am showing you the cavity. Here is the degenerative cavity. Okay. So this is the degenerative cavity. This part of the spinal cord is getting damaged, gone. So now you tell me, guys, here there is a neuron. Look, here there is a neuron which is entering into the dorsal column. Yes or no? Yes, it is entering into the dorsal column. It's carrying the advanced sensation. So I am asking you, because of this degenerative cavity, is there any problem to this dorsal column sensations? I am asking you, any problem to the dorsal column sensation? No, no problem at all. Because the neurons which are carrying the advanced sensations, they are directly entering into the dorsal column. They are not crossing to opposite side. So the dorsal column sensations are not affected, or the advanced sensations are not at all affected. But what about the general sensations? We all know general sensations will cross to opposite side. Touch, pain, temperature, pressure will cross to opposite side. So look here. So this is the neuron which is carrying the general sensations. So it is crossing to opposite side. Now tell me, if it is crossing to opposite side, sir, in this crossing here there is a degeneration. No, so this part of the spinal cord is damaged. So general sensation gone. So touch, pain, temperature gone. So because of this Syringomyelia, there is no problem to the dorsal column sensations, but there is problem to the general sensations. No problem to the advanced. There is no problem to the advanced sensations, but there is going to be a problem to the general sensations. That's what I have written here. So this patient with a Syringomyelia, there is a loss of touch, pain, temperature, pressure. General sensations are lost, but the dorsal column sensations are not affected. They are spared. So this type of sensory loss is called as a dissociative sensory loss, which means some sensations are lost, some sensations are spared. General sensations are lost, but the advanced sensations are spared. So that is called as Syringomyelia. So now you understand, in a patient with a Brown-Sequard syndrome, both dorsal column sensations gone as well as general sensations gone. Dorsal column sensations are lost on the same side of the lesion, but the general sensations are lost on the opposite side of the lesion. In the Syringomyelia, what happens? In Syringomyelia, sir, it is going to be loss of, okay, there is going to be complete loss of the general sensations, but the dorsal column sensations are not affected. Okay, so with this, the two clinical conditions are completed. Hope the video is helpful. Thank you.